Welcome back to the Nutrition Made Simple podcast, powered by Healthy Steps Nutrition. At Healthy Steps Nutrition, we believe something as fundamental as nutrition shouldn't be complicated, which is why we focus on a simple, habit-based approach. We know that helping you become the best and healthiest version of yourself isn't just about what you eat or going to the gym a few hours a week. We focus on a holistic framework addressing stress management, mindset, lifestyle, sleep, support system, and of course, exercise and nutrition. My name is Nicole Coyne, and I'm one of the dietitians and the founder of Healthy Steps Nutrition, CrossFit HSN, and HSN Mentoring. I'm also the author of the Healthy Kids Cookbook, 100% kid-approved recipes the entire family will love. You can find it on Amazon. In this podcast, I'm going to teach you how to take one step at a time to making health a way of life. Today's podcast guests are Ben, Courchia, and Daphna Barbeau. Such cool story between these two people. They're two neonatologists in Broward County, which is where we are in South Florida. And they realized that they wanted to bring healthcare professionals together. We talked about a lot of different things related to nutrition, health, wellness, and something that Daphna coined as moral injury. I've never heard this term before, but it really struck me, and I think that was the thing that stood out to me the most. I actually posted a video about it on our social media today, and the amount of comments that we got from other healthcare professionals relating, saying the same thing was absolutely mind-blowing. So the goal of this podcast is really to help you understand what's going on in these doctors' minds and why we should be really blending these two things together, the lifestyle choices, the lifestyle interventions, what we're doing, what other CrossFit gyms and regular gyms are doing, comparing nutrition, fitness, and accountability, and what happens inside your primary care physician so that ultimately you can prevent chronic disease. I don't think they need to go against each other. I really think that we can all work together, and these guys are definitely leading the way. You can find more information about them in the show notes. I hope you enjoy this podcast episode, but make sure you stay tuned till the end where I take a deeper dive into how I think we can bridge the gap between fitness and healthcare. Benjamin and Daphna, I'm so excited to have you on the podcast today. Thank you so much for joining me.
Thank you for having us.
Thank you, Nicole, for having us.
Awesome. It's so great to connect with other like-minded healthcare professionals who are really just looking to connect with people in the community and help people understand, hey, we can take control of our health and we can connect with other people so that we can ultimately live our best lives while helping others do the same, right?
Mm-hmm. That's correct. That's right.
Awesome. Well, I'd love to just spend the first few minutes today letting our audience know how you guys came together to work together. And you also have a podcast to help neonatologists and other people in the healthcare profession to learn about mental wellness and prioritizing themselves and just get the community together. How did you guys get connected?
I'll start. I mean, Daphna and I, and then you'll tell about the podcast. But Daphna and I found each other by pure coincidence, right? We both finished training in different places in Florida. That Daphna did her neonatology training at the University of Florida. I did mine at the University of Miami. There's no bad blood between either of us. We're cool, you know. And so we found ourselves working in Broward County together. And then it's interesting how as physicians in training, you experience medicine through the lens of a trainee, and there's a lot of protection to make sure that you're focused on becoming a good doctor, right? And that the people around you are really protecting you from all the different pressures of medicine outside of education. And so as you come out, you suddenly find yourself facing administration, insurance, prior authorization, you find all these different pressures. And so it became a very interesting realization for us to see oh, wow, that's a whole different world out here. And when we were talking to people around us, then we found that there's an intense feeling of burnout, of moral injury, of loneliness. And so we thought, what can we do about it? So definitely want to take it from there.
Yeah, I think that's the big thing is that, modern medicine, can be isolating, but the modern world is like a little bit isolating. Like we feel like we're connected, we're online, we're texting, we're tweeting, whatever it is that you do if you engage on social media. But the truth is that sometimes technology, has driven us a little bit apart rather than together. And we found that to be especially true during this kind of formative time in our careers. And we knew that it's hard, you have a lot of, professionals who listen to you. It's hard to keep up with the evidence, and, things in medicine are changing so often. And we wanted to do the best for our patients that we serve and for their families. And so we wanted a better way for us to keep up with evidence. So that's something we do on the podcast. And on alternating weeks, we really focused on interview style, kind of like what we're doing now, and getting to know some of the professionals in our field. And that includes physicians, it includes therapists, it includes parents who have their babies in the NICU or had their babies in the NICU, nurses, really trying to get the whole, go ahead.
No, I was going to say we even had former babies who are now all grown up.
Oh,
that's
wow.
Right. That's right. And really just trying to connect people and remind people, especially in our line of work, the NICU, but that, medicine really stems from, humanity and trying to walk with people in sickness and get people back to health. And so we wanted a better way for us to connect with our colleagues, really, or at least for people to feel better connected. And so that's what we strive to do with the podcast. And now through the podcast and through social media, much like what you guys are doing, we've really created this web of like-minded colleagues. And now we're kind of transforming that into in-person conference as a way to continue the dialogue and, open up people's minds to how can medicine keep up with our kind of current modern society.
That's amazing. I think there's something so impactful when you get people together in person. I remember CrossFit Health years ago used to have these things that they called the DDCs. They would get a bunch of different doctors all together that were really just trying to prioritize health and wellness and bridge this gap between what was going on in hospitals and doctor's office and what was going on inside CrossFit affiliates. And I always went to them and left so rejuvenated and excited, because sometimes it honestly feels like we're on an island. We were talking for a few minutes before I hit record, and, you guys in the NICU and when I worked in the hospital, it was like a quick revolving door. You didn't really have a lot of time to connect with people. You're just trying to see as many people as you can, get what they need to get, and then kind of move on to the next person. But I think you guys are able to make such a greater impact and a deeper, meaningful relationship with a lot of people by doing the podcast interviews and even these in-person events. You're going to have to keep me posted, because I would love to attend one of those.
Absolutely.
Daphna, I didn't know you went to UF. I'm a fellow Gator, so
I
go
did.
Gators.
Go Gators. That's right.
Benjamin, you are outnumbered today.
That's all right. That's all right. We made it to the Final Four this year, so what can we ask?
Okay. So, I think one of the things that you guys talk a lot about is mental wellness and taking care of yourself. And sometimes we were talking about this before we hit record too. I was recently listening to a podcast, and they were talking about the burnout rate for physicians and even suicide rate for physicians is higher than any other profession. And it's so sad, because you guys have dedicated your lives to helping people, spent years and years in education to figure out how do you best serve the communities that you're working with. And yet you don't feel alive or excited, or, like the fire is still in there. Probably going back to Benjamin, what you were saying at the beginning, because you're pulled in so many different directions with insurances, and can we cover this, and can we do that, and what do we have to say, what can we not say? There's so many logistics with the process.
Yeah, that's exactly right. And then we've talked about this issue with multiple guests on the show. Most notably, I think Jimmy Turner comes to mind. He also is a fellow podcaster, and we were talking about this, that not only do you perceive these stressors, but you feel overwhelmed by them. And I think what really clutches this into something that could then be defined as burnout or moral injury is the feeling that none of this can be changed, right? You're feeling that like, oh my God, like this is the way things are. And you don't know if you're the only one who's perceiving these things.
Mm-hmm.
And that is extremely distressing. And I think the COVID pandemic really highlighted that from this standpoint where like, my God, is this the way things truly are? And going back to what you said a few minutes ago, I think when we are seeing this, it's number one, it's the product of physicians having a not really, or providers in general having something that is not really a normal human interactions between a provider and a patient, because the provider is usually there to attend to the patient's needs, the patient's health, and so on. But very few people in the healthcare industry are turning around to providers and are asking like, how are you doing? Like, how are you guys feeling? Is this all manageable? There is this unsaid perception that basically you guys are doing it, so you must be fine. And I think that over time really compounds, and that makes it very difficult to remain in this profession on a long-term basis. Now, without being all doom and gloom, I think something that, like I was saying, you just said a few minutes ago, is the key and the treatment for that is not medications. It's not it is an overhaul and a reassessment of our healthcare system for sure, but at the very least, human interaction. I think if we are able to recreate these connections between individuals where we can communicate, share ideas, and usually the reason why human interaction, because after human interactions with other people who are similarly minded, there's this sense of hope that can be quickly lost in the conglomerate of healthcare. So I think that's what gets us excited, because we feel like there's a real tangible way of intervening when it comes to that.
Yeah, and I think if we really break it down, you mentioned moral injury, and the number one cause of quote unquote burnout in healthcare professionals is moral injury. And the definition of moral injury is, I know the right thing to do for my patient, but the system won't allow it. And so I hope people realize that the reason doctors and nurses and therapists are burnt out is because they want to do the right thing for their patients. They can't make it happen for a number of reasons. And unfortunately, in our current healthcare system, instead of like doctors and patients partnering against, like, I don't know, say insurance companies, they have brilliantly put physicians and patients against one another, by doing the things that Ben said, reducing time to visits, making the hoops like so hard to jump through, partnering with like this narrative that you can either pick like medicine, quote unquote, or this like holistic lifestyle, when really, there are ways that we can combine both of those disciplines to provide optimal health for people. And there are doctors who want to do that, but the system is making it harder and harder for that to happen, I think, because the system wins, really, everybody wins. Physicians win, patients win, families win, when we can work together, I think.
100%. And I remember experiencing this firsthand in the hospital. A patient wouldn't eat as much food, or less than 50%. We had to give them a sugar-filled supplement drink. I'm like, wait a second. We know that overconsumption of ultra-processed food and sugar is worsening some of the chronic diseases that are happening today. Why are we doing this? Like, what is going on? That, and paired with the diabetes management system of how I was only allowed to teach diabetes management at the hospital, was the reason I left the hospital. I was like, I can't do this anymore. It's not worth it. Like, I'm going against every moral thing that I believe here. So I've never heard the term moral injury, but I fully believe what you are saying and empathize with you guys when you talk about that. Now, I think neonatologists, and you mentioned this a few minutes ago, were one of the first healthcare professionals to really start prioritizing nutrition with patients. I mean, every doctor knows, and every healthcare professional knows, like, hey, nutrition is an important piece of the puzzle to help our clients see good results and help us. Most doctors don't even take a nutrition course going to school. So they really have no idea what's going on when it comes to nutrition. But, you guys are really in the weeds when you talk about prioritizing nutrition for your patients, considering they're a couple pounds, maybe. And, why do you think nutrition, healthy habits, and all of that needs to be prioritized, not only for patients, but for you guys as healthcare professionals?
Yeah, I mean, I think one of the most illuminating kind of obvious examples of why nutrition is important is this theory of fetal origins of disease, or the Barker hypothesis, where it's this adverse nutrition in early life predicts poor outcomes, and predicts the development of all of these adult diseases. So we know that nutrition is like critical to like our very beings, and how we grow, and certainly in the NICU, we know that nutrition is intimately linked with our quote unquote successful outcomes in the NICU. What complications does a baby leave with? What does their neurodevelopment look like? And I mean, that starts on literally day one. We can predict by the protein load and the caloric density that we provide in the first few days of life, are predicting outcomes at discharge, and outcomes at 2 years and 4 years in school age. So I mean, I think that is just highlights the importance of nutrition.
Absolutely.
Yeah, I think if you want to find out about how amazing nutrition can be, the NICU is the place for you, because we have data. We have such good data to show how important nutrition is. And so Daphna was mentioning the Barker hypothesis. This is like one of my favorite things in neonatology, the fetal origin of adult disease. And so I think his name was David Barker. But anyway, there was this study that was done during the Dutch famine of like 1944, where they basically had a social system in Holland where they could really track everything and track how much food people were getting and how much people weighed and so on. And what was found was that mothers who were exposed to caloric restriction during pregnancy, their babies down the road developed metabolic derangement. And so there was this theory that eventually ended up being proven, where we see that the nutritional imbalances that we can be exposed to as a fetus can actually have an impact all the way into adulthood. Now, that was initially a theory, and then a lot of studies have been done in the neonatal ICU since then. And it's quite interesting to see that it's really important to strike the right balance. And so Daphna presented a paper on one of the most recent episodes of the podcast, where we looked at what's called extrauterine growth restriction, which is a fancy word for saying like if a baby after being born is not growing as well as they should, then we see impacts of this in up to 5 years of age, in terms of their cognition, in terms of their overall neurodevelopmental impairment.
So far, right? Just because we've only studied it
just because we're only studying it now.
For now, yeah.
Yeah.
And then you may say, well, obviously, if you're not feeding a baby, but even if you're then falling on the other extreme, right? So we're seeing that babies who are having too great of weight gain, or babies who are exposed to too much caloric intake, then they have such more pronounced comorbidities in terms of their pulmonary outcomes, in terms of their brain development. And so we see firsthand that not focusing on nutrition, not being sort of anal about like how much protein does the baby get, that can have dramatic impacts both in the ICU and all the way into childhood. So yeah.
And I would say, we're so diligent about it, right? We're tracking every ounce, every ml, every calorie in the NICU. But you don't need to be in the NICU, and you don't need to be in a famine, to see that. Like, we see that in our own communities still, about malnutrition in our peripartum people, right? And people who are trying to become pregnant, people who are pregnant, malnutrition, or undernourishment, or inappropriate nutrition is changing pregnancy outcomes. It's changing neonatal outcomes, and we know it affects early childhood. And so I think we have a personal belief that, for us in the NICU, if we can impact a family in terms of resources and nutrition at that stage, right, with young people who are pretty healthy, childbearing age, that we can change their outcomes, for the whole family. And so, we don't have to be that extreme about it. We're seeing those changes, even in our own communities, especially down here in South Florida, where, there are communities with really good nutrition and they have access to a lot of resources and fresh fruit and fresh produce and healthy fat sources, versus our pockets that just don't have that access, and the health outcomes are significant for sure.
I think there's so much misinformation out there around food and health and wellness and nutrition. And I honestly believe that parents do not understand how to sort the fiction from the facts. You've got all these claims on different food packages and all these processed foods. It claims, in big green letters, good source of XYZ. And then on the back, it's like, oh man, this is filled with a bunch of junk and high in sugar. And it's a good source of one vitamin, but a poor source of a lot of other things that we probably could do a better job picking some more whole food options. Daphna, you mentioned something earlier that I want to spend a couple minutes diving into. You said that the modern healthcare, the way it is right now, you've got medicine pinned against holistic coaching and like a holistic health outcome. And I think so many times the way people go into the healthcare system, it's like, okay, if we look at the stats with borderline diabetics, pre-diabetics and diabetics, right? 50% of our population has pre-diabetes or diabetes. And then we just wait till they get to the diabetes point and then we give them some medications, when in reality, they don't have to be pinned up against each other. We can prioritize health and wellness. And if we need a medication, okay, but we should be working together instead of just relying 100% on medications, which is just going to cause us down the road of taking a higher dose of the medication or more medications on top of the medications, which is ultimately costing us more money because all of those medications and doctor visits are costing people a lot of money.
Yeah. And the truth is, if it costs one patient more money, it costs everybody more money. And that's something I think people don't understand a bit, the way insurance works in our country. And the mainstay of, the management of prediabetes, and I'm not an adult physician, but this is like med school 101, is therapeutic lifestyle changes. So we know that our counseling for patients to have healthier lifestyles, to be more active, to change their diets, not in some of these dramatic, like fad diet ways, but just by removing some of the, real offenders, or eating them in more moderation, and then increasing, your healthy fats, your fibers, things like that. And unfortunately, the time is not there for that very important counseling to happen. It's being taken away from our schools, how to teach kids about healthy habits. That's totally out of our educational system, especially here in Florida. And so where are people going to learn that? And if the doctors don't have the time to spend with patients, even though they really want to, healthcare systems are not employing nutritionists. They're not. Well, those are the perfect people to counsel patients in health and in sickness, right? About how to get back on track, so to speak. But healthcare systems are cutting things like that, that are really important support people when you talk about healthy lifestyle. And so where are people going to learn? Like, are they going to learn it on TikTok or Instagram? Like, probably not. It's these 30-second bites is like not a formal education. And so, we have to find a better way to educate people in our current system, or change the system, but that's a different podcast.
Benjamin, anything you want to add to that?
No, I think Daphna said it very well.
Yeah.
What? He never says that. He always has something extra to add. But I will say, I think your listeners, nutrition, health, and fitness professionals can play such a role in their communities, right? I think if you reach out and you engage with your communities, I mean, you can really change the health and these long-term outcomes for, we're pediatricians first. So obviously we care about children's outcomes, but you can change it for a family. I think about the adults that we are associate with most often, which are other healthcare professionals and parents. Those are the adults we're most commonly engaging with in our line of work. And I feel like, fitness and nutrition professionals are critical in whether these, like, say the parents we deal with, whether these pregnant people, these postpartum people, and parents in general view their health like as a priority and truly as like a responsibility they have to their families. I think when they step into your office or your gym or your program, like, do they feel like it's a place for them where you can set them up for success? And the opposite is also true, right? Maybe they enter a place and say, well, like, I guess that's just not for me. And maybe, I won't have fitness or nutrition as a part in my life. And I think we support people who have really busy schedules, and in particular parents, with our words, with the way we advertise, with flexibility in scheduling, and like the inclusion of people's families and children. I think that's a way to optimize health for an entire family and not just, an individual.
Yeah, I think that's the key, right? I mean, that's what Daphna, the point you're making is absolutely incredible, because when you're impacting the way somebody looks at their diet, you're impacting how the household potentially looks at their diet, right? And then suddenly you create an environment for children to grow up in a place where there's healthy habits, and then as they grow up, they become adults with healthy habits, and then suddenly you can have a multi-generational impact, and that's quite cool. I mean, when you think about it.
For sure.
One of our biggest referral sources when I started Healthy Subs Nutrition in 2012 was a pediatric gastroenterologist. So many of his patients had fatty livers, high triglycerides, borderline diabetics. And he's like, I don't have the time to help these people. We don't have the capacity to help these people in the way that's going to truly make change. And so that's how I started Healthy Subs Nutrition, was in working with all of his patients. I'm thankful for him. He really helped us kickstart our business with how many people needed help. But what I realized is it's not the kids, it's the parents that need to be educated, and then let the parents go first. So many parents call us like, our office is right next to Boca. So all parents a lot of them want their kids to look a certain way, or whatever the case may be. Or my kid's overweight, they need to lose weight. I'm like, well, what does your habits look like? Because I need you to model that first before. And we actually stopped working with kids that parents won't get involved, because it's a frustrating experience for us if we're not able to help the person that's ultimately the decision maker. Like, your kid's not going through the drive-through. You're going through the drive-through. You're the one buying the groceries. And if you're not willing to make changes, it's not fair for your kid to have to eat something different than you eat.
Yeah, there was this funny story when I was a pediatrician in New York, where I was going over exactly that, right? I was going over healthy habits because we were dealing with a patient who was very young and who was having insulin resistance already, and was dealing with a high body mass index and so on. And so I was trying to say, hey, you have to avoid these foods. And then I think the parent in the room was like, I forget, I'm not going to say the kid's name, I don't remember. It was like, hey, little Johnny, right? It was like, do you see what the doctor is telling you? And like, do you listen to what the doctor is saying? And I'm like, no, like, I need you to listen. Little Johnny, like, just opens the fridge and eats whatever's in the fridge. Like, you're responsible to put that through the belt at the cash register, So it's not something where it's the child's fault. It's something that it's a collective endeavor as a family. So I could not agree. I could not agree with you more. And to your point, by the way, you know how, like, you see this changing in medical school, where I mean, it used to be taught, right, that diabetes, the question on diabetes was easy, right? Type 1 versus type 2. Type 1 is the one that the kids get because it's more genetic, right? And type 2 is the one you get in adulthood, when, if you've not had healthy habits, that this is when it can manifest itself. And now this principle is now gone. It's like, no, we see now children with type 2 diabetes, which means that they're accumulating such bad habits early on that we actually see this happening. And so that's in my opinion, it's a big eye opener, and that's something that is part of why we call this an epidemic. Like, this is something that needs to be addressed, because we can't let kids have these issues so early on.
For sure. I would say too, I even see sometimes the opposite is true when we talk about families and parents. There's so much pressure on parents these days to like be the perfect parent and have they are just working hard. They're getting out their blenders and they're making the organic baby food and they're giving the baby the balanced plate for their toddlers. And then the parents are just eating whatever they can find, right? Because we said, well, I got it on my plate for my kid, and that was my role today. And so, a lot of times, like, the parents in our country right now are falling by the wayside, even when they're trying to make the right decisions for their kids. I signed my kid up for soccer and swimming and baseball, and I'm so busy, I can't get to the gym. I can't do my yoga. I can't take that time for myself. And so, I think it's a tough time to be a parent, and especially when you're talking about, balancing your health and nutrition and fitness.
I could not agree more. I was just in DC 2 weeks ago speaking at a CrossFit event, and I went to a gym that runs our program, was talking to one of their nutrition coaches, and she's lost 80 pounds. And she said she's had 2 kids, and she said the reason why she became a nutrition coach is she gained all this weight during the pregnancies, and she looked at what she was eating as she's giving her child all organic, everything like absolute perfectly balanced meals. And she's just like eating whatever else is around and not really prioritizing nutrition for herself. And she's like, I knew that wasn't the way to set myself up for success. And so she ended up completely changing her diet, started exercising, lost all in a healthy manner, just through healthy habits, simple whole foods, balance. And now she's paying it forward, helping others, which is really cool. But I think that you're 100% right. We've got the parents that don't understand, and then we've got the other parents that are, I'm really prioritizing my kid and I'm putting myself on the back burner, when in reality, what if you're modeling all of the healthy habits and behaviors that you want your kids to be able to implement when they get older without forcing it on them?
Yeah. I think that the final arm leg of that, I would say, is somehow nutrition and healthy lifestyle and good fitness got wrapped up in like our, societal views on things like beauty. And, I think especially when we're talking about parents, there's this like societal social media pressure to getting back to your like quote unquote pre-parent body, whatever that means, body that may not serve your current phase in life, but there's still a balance to being healthy, which is important for mental health. And I think there's just a way to like raise up these like beautiful, amazing bodies that are creating life and sustaining life and like living on fumes to provide for their kids. And so I really feel like the people in your line of work, nutrition professionals, fitness professionals, could be, major advocates in kind of this mental health crisis that we're seeing in parents. They don't have the time, they don't have the opportunities for self-care. They feel sometimes shy or embarrassed or, to go into these places of fitness, or they feel like they're not as fit as they used to be. Can they do it? And so I just feel like there's a way to bring people back into the nutrition and fitness community, I guess, to help. And I think that, there's a real mental health crisis, I think, in parents right now. We see it especially in the parents we work with in the NICU in a whole different way. But even parents of quote unquote healthy children, are struggling.
I think you kind of mentioned it before, right? We're overbooking ourselves. We're overcommitting ourselves. We're trying to do too much in too little time. And that doesn't leave us much time for ourselves. But when people start realizing, your exercise isn't a punishment, it's actually helping you live your best life, and you feel your best. And when you look at mental health and exercise, the research shows exercise is actually more productive than many antidepressant medications if you're doing it consistently and just getting out even for a 15-minute walk after meals, like something so simple. Just going for a walk helps with digestion, helps to stabilize your blood sugar, helps to your mood, energy levels, all of the things. But if we just, I don't think there's one size fits all with exercise. Obviously, we own a CrossFit gym. I love CrossFit. I'll tell everyone about CrossFit, but I think it just starts with getting off the couch and just making time for yourself.
Yeah. Yeah. And we see that in healthcare professionals, right? They work really long hours, they work funny shifts. And so it's hard to be on a schedule. And so they just never go. And I'm not sure what the right answer is, myself included, to get back to a healthier lifestyle. But there's got to be a way that we can bring those people back into our gyms, back into our centers, by offering flexibility. And actually the CrossFit gyms tend to offer a lot of flexibility. They can be a bit intimidating. I've been to a share of CrossFits. So I just think that there's a way that we can, encourage, medical professionals too, to engage with the fitness community. And then I think we would have even better collaboration at helping our communities.
At the end of the day, we all have this passion for helping people. And if we can come together, we can make a greater impact on serving our communities, to helping them and ourselves to becoming the best and healthiest version of ourselves. I'm going to personally invite you guys, whenever you want to come to our CrossFit gym. You are welcome to come to a class and try it out. It's a lot of fun. Can't promise you won't be sore the next day, but I can promise that you'll have a good workout and you'll have a great time. I think ultimately, if we can connect ourselves with other people who have like-minded passions and priorities into prioritizing your health, and you can, build that strong network, I think that's really what helps you be able to sustain beyond the initial motivation of getting started with something. As we wrap up today, any final thoughts that you guys would have for listeners on our podcast? Maybe it's a healthcare professional, maybe it's just a parent that's like, man, I haven't been prioritizing myself and my health. Anything coming up for you guys? Any final thoughts?
I think I have maybe two thoughts that I come to mind when after this discussion and after listening to your opinions and what you guys said. But number one, try to make progress every day. I think too often we see on social media, on internet, we see people who have achieved such amazing results, but after years and years and years of dedication, of discipline, and that could be very, very demoralizing. And so I think, to me, my metric is, number one, am I moving in the right direction every single day? And like you said, maybe I'm on the couch and I haven't exercised in months, and my first step is going to be, all right, I'm going to go after dinner around the block and go for a walk. And that is tremendous success. And then a week later, you can say, all right, I'm going to go around 2 blocks. And then suddenly you're making progress. And then in that journey, just be forgiving with yourself. I think that's also something that we see with our patients. And it's like, if you miss a day, you're like, oh, that's it, I'm a failure. I missed a day. I didn't complete whatever challenge that was. That's okay. That's perfectly fine. Just be forgiving, but just keep moving in that right direction. I think ultimately that's what leads to great outcomes.
Well, that's a tough act to follow. Yeah. I like that a lot. I think my feedback is twofold. One, as a medical professional, is that, we are trying to help people meet their healthcare goals. And I think if you have the opportunity to spend some time with your, family physician, your internal medicine doc, that you guys can collaborate on your healthcare goals. And then, as just an individual, is just, how important connection is, right? We weren't meant to, live so isolated, right? So even in meeting our fitness goals, I think having a buddy, in our nutrition goals, like communal eating, communal healthy eating, like that is such a way to, I think, make change as a community, for sure. So
I love that. Where can people find your podcast? We'll put the links in the show notes, but if people are listening to this and they want to find you guys, connect with you guys, where can they connect with you guys?
I think the best resource is definitely our website, where our podcast is called The Incubator, and you can find out more about it at www.the-incubator.org. You can also find us on all the podcast platform, and there you'll have all our contact information, and we're pretty good at responding to emails. So yeah, please connect with us.
Awesome. Thank you guys for all that you do in trying to bridge this gap with what's going on with healthcare professionals and inside hospitals and just the conventional way that the medical system is running right now. I think what you guys are doing is more important now than ever. So thank you for all that you do.
Thank you, Nicole.
Thanks for having us.
I hope you enjoyed that episode with Ben and Daphna. Man, these guys just have an energy. They're excited to really make a wave on helping healthcare professionals feel connected. And I think that's something that happened with CrossFit Health, where they got different physicians and different healthcare professionals together. And I know that that is a priority for them going into the new year. We actually did an interview on our other sister podcast, Grow Your Nutrition Business, with CrossFit Health. And I know that they're making some waves with that. But what can we do? If you're a nutrition coach, maybe you're a client, maybe you go to a gym that uses nutrition, fitness, and accountability, and you have a primary care physician. Maybe you've lost 50 or 100 pounds. I challenge you to share what you did with your primary care physician. You know, the overwhelming majority of people in the doctor's offices and primary care physician offices, they don't have the time to dedicate what it takes to effectively deliver a lifestyle intervention program. Insurance doesn't cover it. They don't have enough time. But there is a huge opportunity to bridge this gap between the sick people that are in these doctors' offices that really need those lifestyle interventions more than anyone else, and what's going on inside of your gym, inside of your nutrition coaching program, whatever you use. So my ask for you is that you talk to your physician. If you've seen a transformation or you have your own transformation, tell them what you've done so that hopefully we can start getting more connections between the exercise coaches and CrossFit trainers and all these different types of gyms that are doing nutrition, fitness, and accountability and what's going on inside the healthcare system. There's a huge opportunity for us to work together. Anyway, I mentioned at the beginning that I think the biggest takeaway from this episode was coining what I felt and what so many healthcare professionals feel working in the standard conventional healthcare system. This idea of moral injury. You know what you should do. You know what you believe the right thing to do, but you're not allowed to do it for whatever reasons. And there's so many different things that go into this. I think a lot of it goes into what is making the healthcare system money. Sick people make the healthcare system money because insurance companies pay a lot more for that. Medications, those companies make a lot of money off of diabetes drugs. Is it beneficial for them that people take control of their health and reverse pre-diabetes? No. Diabetes costs are so expensive. All of these things are so expensive for people. And I think if we were able to bridge the gap between referral systems and working together, we could make such a greater impact. So my ask for you, if you are a healthcare professional that's wanting to connect with other like-minded healthcare professionals, if you're in the CrossFit space, go follow CrossFit Health. If you're a dietitian that wants to connect with me on social media, I would love to chat with you. I know that Daphna and Ben are planning to host some events to connect healthcare professionals. I think that's really awesome. I know that CrossFit Health is planning to do the same thing. And I think these live events will help prevent the burnout. They'll help us all feel together that we're all rowing in the same direction and help us feel like we're not on an island fighting a system that's, in my opinion, very broken. I hope you enjoyed this podcast episode. Don't forget to subscribe. If you liked it, leave us a review. It really helps this podcast reach more people. take a screenshot, share it on social media. Don't forget to tag us so that we know that you're loving it. Hope you enjoyed it again, and we'll see you back here next week.